Thank you for joining us. I first want to give a big welcome to all of our attendees, our panelists, who I'll be introducing, and a big thank you for everybody for joining. I would also like to recognize and appreciate the support from Moderna. I also would like to let everybody know that this session will be recorded, so just so you're aware of that. And one special feature is that we are going to be allowing live Q&A to be going on, or at least questions, which we'll get into live answering. And you have the ability to upvote questions that you like. So hit the upvote and it'll rise higher in the ranks. So let's go in with an introduction of our panelists. First, I would like to introduce Allison Hill, a doctor of pharmacy. She is the director of professional affairs at the American Pharmacists Association. That is APHA. She leads initiatives that advance sustainable patient care services. Her portfolio does include immunizations, and she represents the APHA on numerous immunization coalitions and work groups. We have Hannah Fish, also a doctor of pharmacy and director of strategic initiatives at the National Community Pharmacists Association, NCPA. She works with member education and research initiatives to improve operations and performance of community pharmacies through the NCPA Innovation Center. And finally, she is leading NCPA's grant efforts on immunizations in collaboration with CDC and Auburn University. We have Margot Savoy, a physician and also the chief medical officer of the American Academy of Family Physicians. She is an associate professor of family and community medicine, urban bioethics, and population health at the Lewis Katz School of Medicine at Temple University. And finally, Gregory Poland, physician and a vaccinologist, emeritus editor-in-chief at the journal Vaccine. He's also the director of Mayo's Vaccine Research Group, as well as the director of research at the Atria Research Institute in New York. I am Todd Willin, also a physician and wearer of seasonal ties. Thank you very much. I am executive director of the Trusted Messenger program. And at the Trusted Messenger program, we are all about empowering healthcare providers and the settings and areas that they work to drive evidence-based decisions, helping their patients by guiding and supporting them to make those evidence-based decisions with communication best practices. As a matter of fact, we have tools and resources for that available at our Trusted Messenger program.org site, and we'll even give you a Q code to some free CME on this. All right, so we are going to jump. Session is being recorded as said. So we are going to jump in. I'm going to give a quick intro and to set the scene that the Trusted Messenger program here is very much reaffirms that people trust their HCPs and want to hear from their HCPs when it comes to healthcare decisions, and along with the communication best practices. But there's a problem because several physicians, healthcare settings, healthcare executives, everybody seems to be a bit confused right now of what's the deal with immunization. So with respiratory season upon us, so flu and COVID and RSV, we know are here and are coming in bigger waves, which will lead to millions of infections, causing hundreds of thousands to millions of medical visits and tens of thousands of deaths this year as a result of these infections. We know that we have federal and state agencies, committees, policies, recommendations, and communications that have significantly diverged from historic norms and recognized evidence-based best practices. And this has really created confusion. So we're hoping on today's webinar to sort through that and to lean on everybody's expertise here. So the confusion for healthcare providers, I use that as a capital H because that's docs, nurses, NPs, PAs, pharmacists, and many more, along with healthcare executives and healthcare settings, administrators, insurers, everybody's kind of, what's the real deal here? So let's try and help. Okay, so with that, I'm going to throw out a question. I'm going to actually pick a panelist. So I'm going to start with Margot Savoy. And I would say COVID's overwhelmed and devastated the world's population since 2020. And yet, over 5 years, it still continues to be a very real and significant threat to health. This continues to be debated in various places, including social media. But I want to know, what thoughts can you share about recommendations for COVID immunizations, given the constant inflow of information, social media content, and noise?
Well, thanks, Todd. I appreciate the opportunity to be in the room where it happens. I can pick up on this Hamilton vibe. I'm glad that we get to have this conversation because I think there's some things we could do that just might make everybody feel just a little bit better. So one of my favorite things about medicine and about science is that it's messy. And most of the time, by the time you get a chance to see it as a patient, it's all cleaned up. And so you just get the final answer that's just do this thing or do that thing. And COVID, it was a devastating and very scary time, but it was also an opportunity for all of us to see science happen real time. And so for some people, that was really disturbing because it means that you saw things like no treatments available and no vaccines available progress into, well, maybe this treatment works. We're not sure into here's a vaccine, into here's a vaccine we think everybody should get all the time, every time, to, well, maybe not everybody needs it all the time, maybe just some people. And that's actually incredibly normal. But for most people, that's not normal because you don't get to see all the behind the scenes part. And so it feels really scary. It feels very messy. But honestly, that's how science works. It's the beauty of the scientific process and how people figure things out and work things out. And so I completely 100% understand why everybody was confused this season. A lot of moving parts, a lot of changes in recommendations, people shifting around. The good news is that some things are fairly consistent. So, consistent thing number one, COVID actually isn't just a fall virus. COVID likes to hang out with us all year long. And so COVID never went away. I know we talk about it a little bit less than we did before. And for people who maybe don't spend time in hospitals or in clinic settings, they may think that it actually went away. It didn't actually go away. It got better. There's still waves. We had a pretty decent one this summer. And I imagine we'll have another wave again this winter or fall. And so getting vaccinated against COVID is still an important conversation to have. Does everyone need to be vaccinated the same way they were vaccinated before? Is a question that doctors and scientists have been wrestling with because we all started using these vaccines fairly recently. And normally we have lots more data ahead of time to be able to decide how we do the schedules. And in this case, we're doing that real time. And so what that means is that we keep watching the data and watching how it's working for folks and then updating and tweaking the recommendations to get them just right for each population group of people. And in this year, the changes aren't really that big, but I think they got a bit confusing because people had to watch them happen, sort of play out real time. And so, in the grand scheme of life, for the most people, you should just get your COVID shot again this year, just like you did every other year. So, from the American Academy of Family Physicians, we think that pretty much anybody 19 and older should just get vaccinated again. If you're 65 and older, you might actually need two COVID shots this year, depending on how the season plays out. Last year, people needed two shots in order to get full protection for the year. If you're younger, there's some more conversation to be had because we did see in the data that there may be some groups of folks who are in that pediatric age group who maybe don't quite need a shot every year, or maybe you want to talk about it a little bit more. I'll be honest, if it was my kid, I would still just get them the vaccine. But if you really wanted to have an opportunity to think about it a little more specifically, younger kids definitely still need the vaccine. So that 6 month to 2 year old age group really needs to be vaccinated. So you had some protection if your parent was vaccinated while they were pregnant with you. You get a little bit of time, like about 6 months, to be okay. But after that, you're on your own. So you need your own vaccine to be able to help you out. So 6 months to 2 years old, they should get vaccinated for COVID-19. But if you're in that 2 year to 18-year-old age group, we may be able to get away with not vaccinating you if for some reason you didn't want to be vaccinated. So there's some groups of people that we know that's not a great idea. So for example, people with asthma or chronic diseases, those folks really are going to need to be vaccinated anyway. But if you're not in that group, we could have a conversation in between your parents and your doc and you could decide whether or not it's the right thing for you to have. But anybody is able to get a COVID vaccine at any age group. And all of those should be covered by your insurance at this point. And so there's a lot of back and forth, a lot of discussion. But at the end of the day, where we landed is that everybody should be able to get a vaccine if they would like to have one. And then there's some people who we're just being really special cautious about to ensure that they get vaccinated.
I appreciate it. And also invite any of the panelists if you ever want to tack on something or add a different viewpoint or an added viewpoint, please do so.
Maybe a little different viewpoint for the 2-year-old to 18-year-old. I think a point in favor of routine immunization, just as we do with influenza, is to help prevent disease among other vulnerable groups, vulnerable school children. But more importantly, is the under-recognized risk of long COVID and long COVID symptoms even in the pediatric age group. And that alone is worth it to me. And like
Yeah.
Margot, my kids, I'm the father of three fully immunized now adult kids.
Yeah, and I will say adult kids always make a little more challenge when we're used to having them in the house and helping make their decisions for them. So adult kids in my household, so or at least not so far away. All right, this next question, again, thank you, panelists. I'm gonna ask Allison a question here, and honestly, this kind of blew my mind because I was not aware that one of the greatest impacts of the pandemic was the emergence of pharmacies as a place of vaccination. For those of you out there that don't know it, and I'm sure either Hannah or Allison give us numbers, it's immense when it comes to the adult population when you look at pharmacies as a place for vaccination. So the new rule is obviously putting opportunities but strains on pharmacies and pharmacists and pharmacy teams as immunizers, right? It is a real disruptive change to our healthcare environment in the US. So as we head into the 2025 respiratory season, what do you see as pharmacy's greatest challenges when it comes to immunizations and maybe best practice emerging strategies, particularly in protecting against COVID, but other respiratory viruses? And by the way, guys, this isn't just restricted. If you have something you want to talk about that's immunization related, non-respiratory, please throw it in there. So that was for Allison.
Sure. Thanks, Todd. And thank you for having me to be able to share the perspective of pharmacists and for pharmacy. But one thing that I love is how the pandemic put pharmacists in the spotlight. But it's weird because pharmacists have been providing vaccines for over 30 years. So just, yes, it's
I
been
didn't
a
know that.
it's been a long time. I actually started providing vaccines when I was a student pharmacist. So even before I became a full pharmacist, I was able to provide vaccines. But that's what has changed. When I was a student pharmacist, the only vaccine that I could provide was influenza. And with the pandemic, with the spotlight, we've been able to change those regulations. So prior to the pandemic, pharmacists were the main ones providing those vaccinations, more than just respiratory vaccinations, but also routine vaccinations. Patients were coming into the pharmacy to get those vaccinations. And only about 2 states were allowing pharmacy technicians to provide vaccinations. But then after the pandemic and during the pandemic, we saw where pharmacies were the main place where people were coming to get their immunizations. So we had a change in regulations. Now we only have a handful of states where pharmacy technicians cannot give vaccinations once the PrEP Act ends. So I would say that spotlight, that impact made a huge impact on how we see pharmacies and pharmacists and pharmacy personnel able to give vaccinations. Last respiratory season, patients, and we're so appreciative that people use us in pharmacy as their trusted vaccine providers. Last respiratory season, 93% of COVID vaccines were given in pharmacies, and over 95% of RSV vaccines were given in pharmacies. So we're making an impact, and we're very appreciative that we are part of this whole immunization neighborhood, which includes physicians, nurses, health departments, and we're able to show where we can make that big impact. One of the greatest challenges, you mentioned challenges that we're seeing for this season, is beginning of the season before it started, we heard all the reports that people would be unable to get their COVID-19 vaccine at some pharmacies. And the reason was because pharmacies, unlike physicians and nurses, have to rely on state regulations in order to immunize. So we have 51 different regulations for each state, for pharmacists to immunize. And because all of those changes, every state isn't open where pharmacists were able to provide those immunizations without guidance from the ACIP. So that was a struggle. But now we have various states that have had emergency orders, governor orders, changes in regulations. So we're opening that up. So pharmacists' ability to immunize is not just completely dependent on ACIP guidance, but also can be determined on that guidance from other medical societies. So I feel like we've had this challenge. We're working towards making a change for it. And that's what we're appreciative that we've been able to do that. And we wouldn't be able to do that unless the spotlight was put on pharmacy, where people appreciate coming into a pharmacy to receive their vaccinations. So we're working to make sure that there will be no interruptions as far as access in the public to get the vaccines that they want.
I'll add a piece in there, and thank you for that, Allison, is as a physician and working with professional medical organizations, frankly, I'm just going to say it out loud. Like pharmacies were kind of viewed as the enemy because that's like interrupting the medical home and disrupting continuity of care. But when you realize, one, how hard it is to get to the doctor's office, and two, when you're giving numbers like 93 and 95% of COVID and RSV being administered there, let's be real. It takes me months sometimes to get into my own doctor. But if I'm picking up some supplies at the pharmacy, it's like what we are looking at in the day and age of value-based care is closing care gaps. And if that gap can be closed at a pharmacy or at a doctor's office or at an urgent care, we need to recognize that hopefully as medical records improve and we can share data, that it's an important place for vaccination. So thank you for that.
I would agree with that, but I'm going to add the other side of the coin to it.
Yep.
There is some interruption in the medical home. It's less, it decreases the opportunity to talk about other issues. Now, my experience is not with academic pharmacists in terms of what I'm going to mention in a minute, but corporate retail pharmacists who cannot tell you the differences between types of vaccine. For example, they cannot tell you the differences between the RSV vaccines or the COVID vaccines. We saw at the beginning of the pandemic less than adequate training in administration of vaccines, prompting us to write a paper on SERVA, shoulder injury related to vaccine administration, and documented locally here that I think 1 out of the 20 or so pharmacists or pharmacy techs actually administered vaccine correctly. Now, I'm picking on nuances of proper administration. I will say that we also see that in the nursing profession, but I have no problem with this important caveat, where they're trained appropriately. And that was not always the case, particularly in the beginning of the pandemic.
Fair enough. And I would go ahead.
Oh, I was just gonna say, Greg, that's a point that I'm grateful that you pointed out. One of the things too that, to tack on to Allison and the pandemic is pharmacy was often one of the only places of care that people could still access because we had to stay open during the pandemic. We couldn't shut things down while we were figuring it out. People still needed their medications and still needed to have those. So, and to Margot's point earlier, watching the science kind of take place, I think we also saw the evolution of the training take place. We were trying to operate at the speed of light. I mean, it was called Operation Warp Speed, right? When the vaccines came out. So all of a sudden we had all of these technicians now able to give vaccines. And so we were trying to get them trained and up to speed just as quickly. So I absolutely appreciate you pointing that out, but we're working on that. We continue to work on that. APHA has a wonderful immunization-based training program that we continue to have more and more technicians go through. And so there are all of these nuance and learnings that we can provide.
I take the step on my patients and my family of marking where the immunization should be administered in the arm.
Yeah. I mean,
I like
again,
that.
yeah, part of this webinar again is looking at challenges as well as opportunities. And to that end, if we remember during the pandemic, a lot of offices started closing access and closing down for certain types of visits where you couldn't even get in for a well visit or get in for certain visits. I will say the flip side of everything we just talked about was if primary care offices can be open the same kind of hours as pharmacies, well, maybe we don't have that problem. That's what we did with our practice. We opened 7 days a week and 4 nights a week years and years ago to be able to increase access as not being a hurdle. But I think this discussion is actually really valid because we still need to improve the administration technique, not just of pharmacy techs, but also our medical assistants, everybody else. Turnover in healthcare is a real issue for everybody.
The other thing is that vaccinology has become more individualized or personalized. So whether we're talking about RSV, flu, COVID vaccines, it's important to recognize that there is a right vaccine for the right person at the right time. They're not the same.
Yeah.
And a lot of retail pharmacies, just as one example, don't carry Novavax because it's not profitable to do so and may not explain those differences. And that's important. I mean, and we all need to do a better job of that.
Yeah. Again, more opportunities for improvement. I have a third question, Greg, that I'm going to deliver to you.
Okay.
Given recent ACIP discussions and decisions, particularly around COVID recommendations, I know that healthcare providers and health systems and various groups have been left scratching their head, particularly when we looked at kids under 2 or pregnant patients. So what kind of advice can you provide to the audience about how to steer this kind of divergence here?
Yeah, I think the genesis of it, and Margot pointed some of this out, the genesis of this has been the creation of chaos and confusion by the administration, actually, where an influential editorial was written and published in the New England Journal saying that pregnant women and children were not at risk and would not be eligible for the vaccine. Thankfully, that has changed or evolved, but it introduced, as I call it, a hermeneutic of suspicion, of mistrust, of confusion about what should be done. So just to quickly cover what Margot already did, I definitely in the under 2-year-old, but I would also advocate it for everybody. But the under 2-year-old is particularly important because their hospitalization rate due to complicated COVID is as high or higher than those who are 75 years old and greater. And they do develop long COVID. So there are reasons to do it. Notably for that age group, you're confined to Moderna's vaccine, which I think is unfortunate because there are other options. They're just not licensed for use in the US in that age group. The maybe another thing to talk about, which you asked about, is pregnancy, and I think this is really underappreciated. In fact, I just jotted this down. Last week, JAMA published an article looking at over 500,000 infants in France. They looked at 75 different major congenital anomalies that might occur in children of women who had been immunized during pregnancy. They found no difference in congenital anomalies between vaccinated and unvaccinated women. In terms of safety in immunizing pregnant women and their babies, these COVID vaccines are safe and effective for mom and baby. In fact, admittedly, while Delta was the worst of the variants we've faced, if you look at the time that Delta variant circulated, unvaccinated pregnant women had a relative risk of death compared to vaccinated pregnant women of 2.36. So this is not trivial. And if you look at infants born to vaccinated moms, their risk of hospitalization is reduced by half. Their risk of symptomatic COVID, depending on the study you look at, reduced by 1/3 to 50%. So, I think it's important to sit down, talk with the family and say, because, other than a few maybe fringe individuals, I take it that parents are vitally interested in the health of their children. They want to do the right thing. They get conflicting advice. Young parents, especially today, have no real conception, maybe with COVID they do, but they don't understand RSV. They don't understand measles. They don't understand polio and what really happens when children get infected with those and why it's so important to immunize. So I guess I'll leave it at that.
No, I would like to say for the audience, and I mean the panelists, we've talked amongst ourselves about these kind of things before too, is nobody, except for some rare individual out there, nobody is not following medical recommendations because they think they're going to harm themselves.
Yeah.
Nobody's not getting a vaccine for themselves or an immunization for themselves, or their kids thinking, this will really get me sick. I mean, they're doing it because they have an action bias. If I don't do it, all this crazy stuff I'm hearing out there, then I don't have to worry about it. But of course, then opening themselves up for infection. So
Wow.
we have to give people grace for the fear that is being created by the amount of noise out there. And again, a big key of what we do at Trusted Messenger program is acknowledging that, listening to that fear, discussing it before we, try and push. If the recommendation is made and somebody says, "Great, let's do it," then you're done. If
I
there's
think there are two other kind of corroborating points to that. Number one, physicians, pharmacists, and your staff, be a role model. Be immunized yourself. I think it's immoral not to, for those of us that are seeing highly vulnerable patients. And the second is to acknowledge those fears, sit down and talk with patients, and go through with them the gradient of protection that vaccines offer. People, how many times have you heard, I got the flu vaccine or the COVID vaccine and I got sick anyway? They don't understand that these are infection permissive vaccines and that the reason to give the vaccines is to prevent hospitalization, intubation, death,
severe
long
disease.
COVID, et cetera.
Yeah. No, excellent point. Excellent point. All
The
right.
other thing that I've heard
Yeah,
come
go
up
ahead.
this year, which I hadn't heard before as a conversation, and I think it's worth just sort of flagging for people, is this idea about getting your flu and your COVID shot on the same day, and whether or not that's going to be a problem, and somehow it makes one invalid for the other, or I can't have it done, so I'm going to come back. But then, of course, people have a very hard time being able to come back. And I think this is particularly true when I think about pregnancy, because pregnancy has a bit of a window. And so when you get sick and you're already pregnant, it is a problem. I mean, it just, people get so sick, and it's not just you, it's also your child. And so if you're trying to protect yourself, the idea of like waiting a few more months just to come back and do the thing is really not always a great choice. But it's not a great choice for all of us in general when we know that you can get both vaccines on the same day without a problem. The same is true with your RSV vaccine happening on the same day if you're in that group as well. And so I think it's worth just saying out loud again, because I think of all of the groups of folks, I think it's true across the board, but I particularly think it worries me in folks who are pregnant who think they have time to wait, but your pregnancy is such a time limited space, and the respiratory season is happening in a time limited space. Like there really isn't a lot of time to sort of throw in waiting, particularly since we're already in October and it's almost November. I would want you to just go ahead and get vaccinated. If you want it in two different arms, that's fine, but like you don't have to wait a whole other day or to come back another visit to be able to get that done.
And kudos for saying that out loud. And I did get both of mine on the same day. It just saves time. It makes sense. It's an evidence-based best practice. Hannah, you ready for your question? All right.
Let's do it.
So influenza continues to be under-acknowledged for its impact on people's health. Additionally, flu vaccines continue to get called out for their variable effectiveness at preventing infection. I think Greg just jumped into this one. We've mentioned the importance and the trust in healthcare providers. And again, we've already acknowledged now pharmacists playing a key role as a healthcare provider. So how would you suggest pharmacists and other healthcare providers tackle the perception of, flu, it's just like another cold?
Yeah, absolutely. Well, and I think Greg kind of teed this up really well for the conversation. But he's right. We need to really work on our messaging as providers to make sure our patients understand what vaccines actually do and don't. And it's hard to explain this very complex science to our patients. So again, the messaging around the vaccines aren't necessarily going to prevent you from getting this disease, but we're going to prevent you from getting severely sick and needing to engage in a hospital visit or emergency visit. And I'll use a personal example. I have a family member who's young, healthy woman. She got flu last year, and it was before she was able to even get the vaccine. But to get that call to know that my sister was headed to the hospital, like that's scary that even healthy young adults can still get this virus. And so this year she's been like the biggest advocate. She's also in healthcare, but to be able to say like I don't want to live through that again. That was miserable. And so I think it's, again, trying to have that conversation of how these vaccines actually work and what we're trying to help prevent, especially for our patients that are at higher risk of the disease and then may have more complicated treatment plans if they were to have to go to the hospital. I think the other key piece of flu, especially, is right, and somewhat of COVID, is the virus is ever changing, right? It's science in real time, right? We're trying to figure out what the strain is going to be each year to give you the best protection. And so, yeah, there's some years where we get closer to being quote unquote right. There are other years where we don't necessarily figure it out as well. But this year we saw the most deaths of children that we've ever seen in the past
280,
10 years or so. Yeah. And that's just so sad, right? We have these vaccines that are preventing the severe disease, are potentially preventing death, and yet we're still seeing it. So in terms of how do we help build that trust? How do we encourage that? I think it's really just kind of emphasizing the point that, again, there's a right vaccine for the right person at the right time, and that anything that anyone hears or sees on the news or social media or wherever they might be getting that information is to question what they hear and go to the person that they trust the most, right? We still see that nurses and pharmacists and physicians are the top 3 providers of health information above any other news media, or even
And
we're
this
seeing
includes
CNC.
polling data, even as of this year, Hannah, to your point, even in this
Even
environment in 2025, my healthcare provider, my pharmacist, my doctor, my school nurse, those types of connections are critical.
Yeah, and to your point, even of this year, even as of like 2 weeks ago, that data is still what
Yes.
it's showing, and we're showing too in some of that recent data that the trust in even the CDC, because of some of the chaos and the confusion, if you will, that's happened, is about 50% right now. Physicians, nurses, providers are still way above, closer to that 70%. So
70 to 80.
again, yeah, exactly. And so the key message, I think, for any patient is ask the questions of your providers. We're here to help you. We're here to engage with you in those conversations, because just because I saw Aunt Jean had some crazy reaction and whatever that is that she had, doesn't mean that you or me are going to have that same one. But I hear that concern that you have because your aunt experienced that. But let's talk about why you might not have that same reaction, or why she did, because you guys are 2 different human beings. So let's have a conversation one-on-one to figure out what's right for you.
Yeah.
I think sometimes the trust part gets disrupted because people don't level set expectations at the beginning of what we're here to do and what we're not here to do. And sometimes people get afraid of what they think the patient's reaction is going to be to hearing what could happen, and then they choose to not talk about certain things. So, for example, I have always been very transparent about the fact that I have had the flu. It was one of the worst things I ever had. It was a horrible feeling. I didn't know hair could hurt, and my hair hurt. It was just awful. And I decided I never wanted to do that again. So, how can I minimize my chances of not getting the flu? Well, the flu shot is one of many things you can do that includes washing your hands, which people have started to not do again. It includes thinking about wearing masks in certain high risk situations, which people have started to not do again. There's lots of things we could be doing. Staying home when you get sick and not being around other people when you're unwell. And all of these things come together in a great sort of cocoon of things that should make it possible for me to not get sick. But if you tried to tell me, Margot, getting the flu shot won't get you the flu, that's a true sentence. It is also true that every year when I get a flu shot, I don't feel that great for a day or 2 afterwards. And you know what? That's actually normal and okay. And if I tell you the truth, that there's a chance you may not feel that great and that's normal and okay, when you don't feel that great, you knew that might happen and you feel okay about it. You're not excited about it. I'm never thrilled that it happens, but I now know to plan, right? So I get my shot done on a Friday because I don't have to be back to work till Monday. I can make things work out. It's not a big deal. Honestly, the COVID shot makes me feel the same way. So I get them both the same day. So I can feel not that great at the same time, and I can be better by Monday and go on back to do what I need to do. But the reality is that sometimes we try to diminish those things because we don't want people to be afraid, because we know that in the long run, getting the vaccine is still a better choice than getting the infection. And so we try to make it better. And I just advocate for people being transparent. I mean, like, the idea that you're going to get a shot and it will be 100% effective about protecting you from much of anything is not any more wise than thinking that there's a seatbelt that exists that could save you in every car accident. It's just not the case. But I tell you what, not having on your seatbelt, there's a very good chance that if you get in that accident that you're going to end up really hurt or you might end up dead. And so to me, I think about it more that way. And when you reframe it and you really level set some of those expectations, it makes it different. No, I don't want to give a person their flu shot the day before the big game, right? So, I mean, if I'm the kid, I'm mad too that I thought I was going to be the starting quarterback in my football game this weekend. And now I can't use my arm because my arm is sore. Well, that's our fault. We didn't do a great job really level setting and setting those expectations and giving you the right anticipatory guidance about what was going to happen. But we can do better about that. And I think patients will trust you because you're telling them the truth about what's going to happen and helping them be able to live their life and live their life in the healthiest possible way with the protection that they need to do what they need to do to live the life they want. And so I think in the end, part of it is us also owning the fact that people spend so much time talking about how you don't get the flu from the flu shot that they miss the fact that some people don't feel great. It's not the flu though, but you still don't feel great sometimes. And if
But
you're one of those people, we can mitigate that.
might be worth talking about the data that just came out about flu vaccine effectiveness in the Southern Hemisphere.
Yeah.
Overall effectiveness was 50% against illness and hospitalization. For influenza B, it was almost 80%. So I've begun to wonder, since there's such widespread acceptance of untested, let's call them supplements or health supplements, whether we should be talking about vaccines, since they're preventive, not therapeutic, about them being longevity supplements or health supplements, because they are.
Yeah. I don't think people think about that, but every infection you get probably takes out some capacity in your body for your overall longevity, as you said. Wait, we have a news flash coming in. By the way, healthcare providers are not trained in communication. So you actually, if you're watching this, happen to be watching 4 people, I'll add myself in 5th, that actually have some training. And that's one thing that we continue to bring up, that you're getting nuggets here, level setting or active listening, that healthcare providers, pharmacy schools, medical schools, nursing schools do not teach. As a matter of fact, there's some 22-year-old out there in Kansas or somewhere in the middle of the country who's able to convince you to take anti-parasitic horse medicine rather than a vaccine that's been proven to be effective, because guess what? They're a better communicator. So I will keep plugging. Communication is going to be a key role, whether it's level setting, active listening, or taking through the gradation of the protection. Those are all really key issues. We do have some upvoted questions here. I want to throw one more in. So one more I had written, but then I'm going to go to the upvoted questions. The last one is that RSV protection is relatively new. This is going to be for anybody who wants to jump in. Relatively new, but it also exists in different forms. It now comes as vaccine protection or monoclonal antibody protection. It also depends on the patient's age, their pregnancy status, and where they happen to be, the healthcare setting. That all now impacts it. So what advice do any of you have for healthcare providers to help patients and families understand the importance, but also how to steer through that complexity? Anybody want to take a stab at that? And we won't spend real long because I want to go to the upvoted questions, but I do want to see what anybody thinks on this.
Well, I think I'll start with it. Again, I believe in individualized medicine. So whether you're pregnant, if you're older, if you have a previous history of Guillain-Barré, if you're intolerant of mRNA-based vaccines, there are different options here. There's monovalent, bivalent, mRNA platform-based. So, we're fortunate in that we have 3 choices in the US. Pick the right one for the patient and help them to decide.
Wait, I'm going to pause for a second. Are we talking about COVID or are we talking about RSV?
Oh, I'm sorry, RSV. Did I say COVID? I meant
Oh, you said RSV.
RSV.
Yeah.
Okay. And I appreciate that, Greg. I'm going to go to anybody else want to jump in on that, or else I'll go to the first upvoted question.
So when I think about RSV vaccine, for a lot of people, it probably isn't going to matter to you necessarily yet. So the vast majority of adults are not necessarily in the group that are going to need RSV, but it doesn't mean you shouldn't learn about it. because you can actually still get sick with it and you can still pass it to people and cause a problem. But I think about it as like one of those things that's on the edges of age. So young people and people who are pregnant, because remember, people who are pregnant are carrying the youngest of the people. And then older folks are the ones who tend to need to be vaccinated. We don't tend to give monoclonal antibodies to the older folks. They're usually getting a vaccine, and depending on your age would depend on which vaccine and if you needed it earlier versus later. And so you would talk to your doc about that and they could help you figure that out. And for the younger people and for the pregnant folks, it gets a little bit weird. So there's a vaccine that you can use that works really great. It only really works so the first time you're pregnant during the season when you need it. So if you were to have subsequent pregnancies, your children would have to get treated because you couldn't get revaccinated. And so it gets to be a bit tricky because you've got to decide a lot based on exactly when you're pregnant, exactly when the baby's going to get born and what's going on. So it's another one where I would ask the question if you're not sure, but I would hope that your obstetrician or your family doc that's delivering you would be having that discussion with you anyway if you fit into the window. But I think it's more complicated than all the other ones. Flu is real simple. Like everybody 6 months and older, just get a flu shot. COVID's pretty straightforward. For the vast majority of you, just get a COVID shot. RSV gets a bit weird. And so that's one that I would sit down and have a conversation about. And I think for the vast majority of people, you're going to kind of shrug because it's not really about you yet. But you'll get old enough at some point where it does become about you. And so you'll need to know about it, or you'll have a family member who probably will.
Or develop a chronic medical condition.
Yeah.
Makes
Yep.
you eligible.
So we should be learning and teaching our families about it. All right, I'm going to go with the first upvoted question here, which is, how can school nurses and pediatricians collaborate to increase vaccine compliance? And I would also add in there family medicine doctors that are taking care of kids. Anybody with a thought? I'm happy to jump in on this one too, but ways that school nurses and healthcare providers of kids can collaborate to increase vaccine compliance or adherence.
Get them involved in the curriculum development. Let me take you back to when seatbelt laws were first introduced to the US and when the anti-smoking campaign started. The state with the greatest benefit, that did the best with those, was the state of Colorado, who decided to educate people who didn't smoke and who didn't drive, i.e. school children, and it worked. So if we teach them science, if we teach them the scientific method, if we teach them about vaccines from sort of their earliest school days onward, and this is where I think school nurses and pediatricians have generally not been involved in the schools, which is a little different twist on your question, Todd, but just one avenue to do so.
Yeah, anybody else want to jump in? I'm happy to, because I've had a chance, thankfully, myself and Chad Herman, our communications VP, to address school nurses who want to play a key role here. And I will say, for many families, they very well may be recognized as a key health provider because they may be one of their only contacts that they see on a regular basis that they know that they can trust. Don't forget, the school nurse may see that kid more than almost anybody else. They're seeing them how many days a year for how long of a time. And so I think that the question does beg the issue of how can we interact more effectively and open up channels of dialogue. And frankly, in the healthcare practice that we had, a pediatric practice, we did have more connections to the community as well as to schools and school nurses. And I think it's easy to view a school nurse as, oh my gosh, they had me filling out that form and they didn't like the way I filled out the form. Well, they have work to do, and their whole work depends on accurate collection of information. So rather than viewing it that way, I think they're a key team member to helping that particular child's health. And so I think we need to be mindful again of opening up this type of communication. Matter of fact, with the Trusted Messenger program, we've already spoken to the New York City school nurses. We spoke to the Philadelphia school nurses. We're about to speak to the Pittsburgh and the Pennsylvania School Nurse Associations, and we have some others, I think West Virginia, where they really want to play a more active role, because right now they're saying with all the confusion and noise coming from all sorts of angles, we want to play a role in helping to educate the families as well.
That's great.
So I think
If I
one
could
of the
just jump
exciting
in.
things.
Yeah. Let's go Allison and then Margot, and then I'm going to do another upvoted question.
Yeah, I think everybody had so much to add on this, but also I I give you the opportunity to include your local pharmacist into this collaboration because in many states, pharmacists are able to immunize for patients 3 years and older. So that catches school-aged children. And pharmacies can provide vaccination clinics at the school. So with school nurses having the information and already knowing about how to obtain consent from the parents, a good way is bring the vaccines to the school. And if you go to pharmacist.com, we also have resources where you can collaborate with pharmacists. But if you need any information, I would be happy to share with you who has this question on how to collaborate more with pharmacists and getting those vaccines at the schools where you can collaborate, and also getting the information to the pediatricians.
Got it. You okay if I jump into the next one? This is I think one that's front and center with many people's minds out there. What evidence is there that children and healthy adults should get a COVID vaccine, especially if the patient's already had a COVID infection? What is the evidence for duration of natural immunity? We want scientific evidence of the need to vaccinate. Who wants to take a jump at that?
Well, there's about 5 questions wrapped in there.
So need
Both
for healthy kids and
vaccine,
adults to get it, and especially if they've had an infection.
yeah, both vaccine-induced and infection-induced immunity, humoral immunity, wanes with time. The truth is, if you get a COVID vaccine, you are protected generally against infection for 8 to maybe 16 weeks. The duration of protection against hospitalization, against long COVID, against death is far longer. That's true of both conditions, whether you got infected, whether you get vaccine. Having been infected does not give you lifelong immunity against these things. So, and you certainly don't want to get repeatedly infected because complication rates in long COVID actually increase with each infection.
Yep.
So the question is a good question. Those data are readily available. Excellent papers that demonstrate this.
And if I could just tag onto that, this isn't so much the data or the evidence, but it comes down to our messaging, right? With COVID, since it's such a new vaccine, it's not something that has been routine recommendations every year consistently, like the flu vaccine, for example. We've used terminology of you need a COVID booster. Well, booster might not be the most accurate term in the case of this virus because it's not something that we're just building your immunity back up to the same thing that has waned over time. It's an evolving virus. So it's just like the flu vaccine, in which case you need to get a new one as the virus shifts and evolves. So I think making sure that it's and as the evidence continues to evolve, whether it's your annual vaccine, whether it's your seasonal vaccine, whatever the right terminology is, we have to figure that out as the healthcare providers, because I think booster has gotten kind of lost in the conversation, like, well, I've already had it, why do I need a booster? It's no, you actually do need another one. Just like you get your flu shot every year, you need to get your COVID shot every year. And
another communication best practice, just the semantics in the words, right, is it's an updated, right? Booster might think I already have enough, I don't need to be boosted, but updated is it's the most current relevant vaccine we have available to match the most current circulating strains around. Again, another communication best practice. All right, so another upvoted question is, would you please discuss recommended childhood vaccinations and how to address this with vaccine hesitant parents? And I will say, I no longer even use the word vaccine hesitant. I use questioning, because now hesitance even become kind of charged. And so I think everybody has the right to ask questions. So anybody that wants to chime in, and definitely I like this one, I talk about it a lot, but thoughts on how to really discuss vaccinations, immunizations with parents who have concerns or questions in spite of understanding that they're recommended.
So I always think about this like it's two different things. So my recommendation isn't a question. It's not even a conversation. So like I have a recommendation. It's what I'm advising you to do based on my expertise and what I understand and what I think. And I owe it to you to share with you my recommendation. So my recommendation has a period at the end of it. So If I'm telling you I think you should get the flu vaccine, I think you should get the flu vaccine. And there's a period at the end of that sentence because I'm all 10 toes down that this is what I'm recommending, or I would have told you why I wasn't sure and what it was that I wasn't sure about. So recommendations to me are separated from what happens after that. So after I tell you my recommendation, we then have an opportunity to have a conversation, and that conversation could take lots of forms. And so it could be a conversation that goes down the path of, well, I agree with you and we're just going to get the vaccine and we move on, and now we're talking about what things we might expect and how we're going to navigate what might happen next. Or we're talking about the fact that, well, actually I've got some questions about it, in which case we're going to address your questions in the order that you're asking them with the most accurate evidence that I have available. And if I don't know the answer, I'll tell you and we'll look it up together. But like, we sort of have a discussion that sort of happens. And so when I think about vaccine hesitancy, I'm with you on this one, Todd. Like, I think lots of people hesitate about lots of things. We've turned vaccine hesitancy into this weird word. I hesitate when people tell me I need to get the tires changed in my car because I know how much it's about to cost and I'm not really sure. But the recommendation to change the tires on my car doesn't change just because I hesitated at the price of the recommendation. It just is what it is. But now we could have a discussion about whether I needed to change all 4 tires or 2 tires, and what's the danger of changing 2 and not the other 2. What's the danger of not rebalancing if I do it? To me, vaccines are the same thing. And so there's pros and cons for all of the things. And people should absolutely feel comfortable asking their questions and raising their concerns. There really isn't a stupid question. I know that people feel like you're going to somehow get mocked or people are going to make fun of you. If your doctor is mocking or making fun of you, you probably should just get a new doctor, because that's not really the right place for you to get your care. But from a practical perspective, your questions are your questions. I do think that sometimes people get afraid on the physician side, and I won't speak for all the other clinicians, but on the physician side, because not everybody might be you who comes in and asks a question because you genuinely are asking a question. Some people come into the doctor's office and they're coming attacking and challenging and being kind of mean about it, as though somehow you also wanted to hurt their kid or you wanted to hurt them. And for a lot of physicians, that really hurts them to their core because that's 100% not the reason why they chose to go into the field. And so they get a little defensive and they start to want to sort of preempt that by wanting to cut off the conversation and make it different. And this is a space where I would ask our whole society to just take a breath and to go back to what we all came here to do. So what we came here to do was for me to give you my best advice based on what I understand and know, and for you to share with me your lived experience and what you're hoping to get out of your healthcare journey, and then for us to find the meeting of the minds that works, and then for you to choose the care that you're going to move on with. And if we can get back to that, I think everybody could have a much better experience. And you wouldn't have to worry about the hesitancy part, and you could have the conversations you need, get questions answered that you need.
And I don't disagree with making a recommendation. The caveat I would add is how to frame that recommendation. So I would start with, and there are 2 papers I'll refer you to. Both.
I just want to point out we have 5 minutes left. So if you want to make this part of your closing remarks, Greg, I will start with you with closing remarks because we each get 1 minute.
I refer you to 2 papers that my daughter and I wrote. One is on cognitive styles and decision making. So figure out the cognitive style. It's easy to do that your patient is used. Is it fear-based heuristics? Is it data-driven? Is it conspiratorial? Is it low complexity cognitive thinking? And then model your recommendation to their needs. The second is what we call the empathy tool that we designed with a human-centered designer so that you are inviting a conversation. It's not always one and done. Sometimes the discussion about a vaccine and eventual vaccine acceptance is a journey, and this tool is a help in doing so.
Thank you. And Allison, closing remarks. We're going to keep these short for each of us, and I'll give one last little tidbit at the end.
Sure. I think a part of communication and being that trusted healthcare provider also includes confidence. And just wanted to share a resource with everyone that we still maintain our vaccineconfident.pharmacist.com site that has webinars, podcasts, videos, and articles on the vaccine confidence strategy to inform and educate. And also on that site, there are vaccine access maps for the public and for providers, and you can filter to find data via your county, state on social vulnerability, medically underserved areas, and health professional shortage areas. So it is a resource that's available to everyone. There is no charge, and you do not need to be a pharmacist to use. It's open for everyone.
Terrific. Hannah, closing remarks.
Absolutely. I echo everything Allison just said, but one quick thing I wanted to go back to that Greg had mentioned about retail not supplying certain vaccines because of the idea of profit. I think one of the things that we have to remember as healthcare providers, just like Allison said, from the regulatory side, that includes the payment that pharmacists are able to bill for. We don't get to bill like physicians where we get an office visit where we're talking about other things. So we're having these conversations with our patients, but we're paid based on the product that we ultimately give. So we need to talk and engage in a conversation about changing the payment model for these conversations. And until that can change, unfortunately, these businesses are going to make decisions that help cover the costs of their services that they're providing. And also to the point about retail pharmacy, not all pharmacies are the same. Just like Margot mentioned, if you're getting poor treatment or recommendations, there are small independent pharmacies that are still out in the community that are in some of the most rural locations. There's pharmacies and grocery stores. There's a pharmacy that's right for you. So just know that if you've had a bad experience in one pharmacy, that doesn't mean that there's not another pharmacy willing to take the best care of you.
Thank you. Margot, last closing remark for you, and then I'll try and end it out quick.
So thank you again for inviting us. The American Academy of Family Physicians does have a vaccine set of recommendations that go from birth all the way through geriatrics. And so you're welcome to access that if you're a clinician or if you're just interested at aafp.org/vaccines. And if you're on the patient-facing side and you're looking for information that's written more at a level that's just sort of easier to understand, familydoctor.org is what we use in our office, try to help support folks. It's also supported by the AAFP. At the end of the day, like my only closing message for everybody is that vaccines are safe and effective. That doesn't mean that that's necessarily the choice that you want to make on that day, but you can ask questions and you can make the decisions that you need to make. And your doctors and other healthcare providers are here to help you. Just know that at the end of the day, vaccines are still safe and effective, whether you choose to get them or not.
I want to thank all of you for being panelists. I've actually really had a lot of fun with this webinar. Thank you, the attendees, and also a reminder that the Trusted Messenger program is all about improving healthcare provider communication to really drive evidence-based decisions by our patients by providing them with communication best practices. It's a real thing. We are not trained on communication, though we should be, whether we're pharmacists, whether we're docs, whether we're nurses, PAs, or NPs. This is actually a CME module accredited for all those groups for an hour of free CE or CME on being better healthcare communicators. And again, a huge thanks, and hopefully let's do our best to continue to protect our patients and their health. And thank you all for attending.